Hansen's disease is a chronic bacterial disease that affects the skin, peripheral nerves, and the upper respiratory tract, as well as the eyes. Hansen's disease, caused by the bacterial Mycobacterium leprae, belongs in the prokaryotic kingdom. The domain bacteria is in the Actinobacterium phylum and in the Mycobacterium genus. It is a rod-shaped bacterium with shaped or slightly curved bodies between 1 through 8 mm in length and 0.2 through 0.5 mm in diameter. It is an obligate intracellular organism, so it is strictly replicates and survives in host cells, and it spreads through binary fission, taking around 12 to 14 days. It is non-motile and doesn't form spores.
Hey, Ms. Martinez, how are you today?
I'm good, doctor. I just haven't been feeling too good lately.
Oh, I'm sorry. I'm really good. What's been going on?
I've just been feeling tired and sick lately. I've been getting these red marks on my skin. Lately my vision's been pretty bad and just feeling numbness as well in my hands and my feet.
How about I take a look? Yeah. Let me see. Yeah, so that really started to
I have some here, and then I have some on my feet.
You said you had numbness too, right?
Yes.
So I'm going to do a couple taps in your hand and I want you to tell me. Is that nope?
Don't feel nothing.
You're going. Okay, well, I'm going to take a couple samples of your skin so we can do some tests over it. So is that okay?
Yeah,
I'm
that's
gonna take back. So you said you had some on your hand and your feet. So I'm going to hand this over and then see your test results and then I'll be right back. Okay, so I handed it over to my microbiologist. We're going to do some tests. But I really want to ask you a couple questions. So when did this all start and what patterns have you noticed since then?
First came the red patches on my skin. All of those started about a month ago. They've just been getting worse with time and more irritated over time. And then after that came the numbness in my feet and my hands about 2 weeks ago. And then later on came my vision getting worse and worse.
I see. So my epidemiologist is going to come in and ask you some more questions.
A few moments later.
Martinez, I noticed that you've been not feeling good lately. Have you traveled out of the state, out of the country lately?
The only thing I can really think of is a couple months ago, I went with my charity group to go to Africa to help feed children. That's the only place that I've gone, though I've never really traveled outside of that.
When you traveled outside the country, did you notice anybody that had like their rashes that were not feeling good lately when you were around them?
I didn't notice anything. We were only there for a short period of time, maybe like a week or so. So in that period of time, I didn't really notice anybody with anything.
Yeah, we have your results about the test. But I'm gonna go talk it over with your doctor to see if what's going on and like if it's like very
Hi,
severe.
doctor. Can you tell me a little bit of how Ms. Martinez's tests are going?
Yeah, hi doctor. Her results came back and her PCR test confirmed she had Mycobacterium leprosy, and her CO mucin stain showed acid fast bacilli, and it showed that she is very contagious at this stage. She should not be in contact with other people during this moment.
Yeah, I agree. So we'll go back and we'll let her know.
Thank you. I'll go ahead and notify my superiors at the public health department so we could contain this and not have it spread more. And make sure to quarantine in your house and not be around anybody so you don't spread it more.
Eternity later.
Hi, Ms. Martinez. So me and Dr. Ibarra just went over your test results, and it shows that you do have leprosy, shown as the Hansen disease. So this is most likely caused from your trip to Africa, because leprosy is very, very common in that area. So we'll go ahead and start you on multi-drug therapy. So that's what we use for leprosy, and that just means that you take more than one medicine at the same time. So leprosy is a slow-growing bacteria, so using multiple medications together helps kill it faster and stop it from coming back. And also prevent the bacteria from becoming resistant, which also means that the medicine will keep working well. So I'm gonna go ahead and prescribe that for you and send it over to a pharmacy.
Okay, should I come back in like a couple of weeks or how does that work?
Yeah, so we'll send you a text and